he says it's young people. As a data scientist, what is it that you believe is behind the spike?
Well, first of all, on my alternative site, FloridaCOVIDAction.com, I debunked all of those assertions. There was not an increase in cases among Black or Hispanic communities. There was actually a decrease in both at the time when he said that. The general population statistics have kind of held steady for most of the time. And there is an increase in younger people overall, but if we consider, let's say, Southeast Florida, where the majority of cases in the state are down there, then we actually see a disproportionate number of older population. For example, the median age, which isn't a give-all for all of the data, but it's 4 years older in Miami-Dade and Broward than it is for the rest of the state. They also have a disproportionate number of 40 to 65-year-old cases, much more so than the rest of the counties in the state. So the areas where the largest volume of cases exist, there is actually an older population that is responsible for most of the surge. The claim as to whether or not testing is resulting in higher cases, yes, of course, if you test more people and the virus is more prevalent in the population than what you had assumed, then you're going to see a disproportionate or unexpected rise in cases. The fact that so many young people are now getting tested isn't so much that they're now more infected or more symptomatic. It's that they're in the type of jobs that were largely forced to reopen or lose their unemployment benefits. Things like retail or public service positions, hotels, things like that tend to be younger employees. So they're the ones who are being most exposed. A lot of healthcare workers are, being repeatedly tested as they should be. There was a new mandate that nursing home facilities, assisted living facilities, things of that nature had to undergo testing each week. So there is a large influx of testing, but if the proportion of cases increases among your percent tested, which it has been consistently and shockingly so, then that's not an indication that testing is responsible for your increase. That is, you have a surge in cases that is extremely concerning and upsetting.
So after you were fired, you started your own dashboard to track cases in the state. Do you know who's using that data?
All of the data on the Florida COVID Action website is actually DOH data or data from another state agency, such as the Department of Emergency Management or the Administration for, or Agency for Healthcare Administration, and that is what we call the AHCA data. That is hospital surveillance data, so how many open ICU beds there currently are in the state, how many pediatric, adult isolation beds, that's where all of that data is maintained, and it's been public since April. So this isn't new data, it was just never allowed to be used on the DOH dashboard while I managed it, and I actually asked repeatedly to add hospitalization and surveillance data because every epidemiologist we spoke to said that this was one of the most critical elements of information in deciding whether or not you would reopen or whether or not you were observing a surge or if hospital capacity for whatever reason was greatly diminished and you're seeing a rise of cases. That's something you need to plan for ahead of time. But I was always told we were not allowed to add it.
Well, as you know, the governor there is pushing the state to reopen. How do you see things playing out for Florida?
Well, I think last week's surge in cases, or over really the last 2 weeks, plus whatever we'll see coming from July 4th weekend, which was for most parts of the state, with the exception of some counties, largely open, I think we're going to see something extremely worrying. And I think the fact that the state's lead epidemiologist quit after 15 years on the day that DeSantis announced that we were reopening K through 12 schools at full capacity speaks volumes about what the scientists think about these decisions.
In our last minute here, I want to ask you about communication to the public. So your dashboard has been praised by Dr. Fauci's White House Coronavirus Task Force colleague, Dr. Deborah Birx. How critical are those kinds of briefings, like the kind that we had been hearing in March and April on an almost daily basis from the White House?
They are incredibly important. People trust in their public officials to give them information. And even if we're sometimes skeptical of that information, we still want to know what's going on. We want to know what's being said about what's going on. And despite all of the progress I've made with my new dashboard, there are still critical information elements that DOH and the state itself has that they're not releasing. For example, every single day, every county has to issue a situation report to the state. And in that report is all of the testing information, the actual percent capacity for hospitals, which is not available anywhere else. A list of all of the community food sites is in there. There's a plethora of information that the state has and is not making readily available to the public, which is extremely concerning. I've gotten emails since I've left of people saying, I don't know where to go get food. And I'm looking them up one by one right now to try to help them. But the state has these resources and they just don't tell anybody where they are or make any kind of central location to get that information, which was something I pushed for at DOH the entire time I ran their dashboard.
All right, we'll continue to watch the situation there in Florida very closely. Rebecca Jones for us. Rebecca, thank you very much.
Thank you.